Hello and welcome to the latest and greatest episode of Better Together Arizona. Today we have some really remarkable guests joining us as we recognize HIV and AIDS Awareness Month. Our guests have been trailblazers in raising awareness, breaking down stigmas, and creating access of care for folks living with HIV and AIDS and our greater community. Let's have our guests introduce themselves, and we'll start with you, Kirk.
Kirk Baxter. First and foremost, I'm an activist. Always have been, and I had the pleasure of being a part of many organizations to start because I got an early start at the age of 19. And so I'll say a little bit more about that as we start talking about some of those. And currently, I've stepped back. I took a step back really for family reasons, and it was the right thing to do at the time, and now I'm trying to decide what's next. And I find that I'm now living in an era where some of what I used to do may be necessary.
So you can remind us of how to activate and engage.
Yeah, well, sure. And so, I will say that it's impossible really to talk about our primary topic today without acknowledging the gay community and the start, really. The very first Pride event here was a march to the Capitol, and the theme was "We Are Here" on our T-shirts, as if we had to prove we were. And so it grew from there into what it is today. But I co-chaired the first 5 of those, and I ultimately did that from my platform being at the president of Gay Academic Union at ASU, which was my first leadership gig. And so from there, honestly, we got some national attention here from some crazy things that were happening, and that led to me having a different profile. And the first board I went on was National Gay Task Force before it became NGLTF, based in New York, and then National AIDS Network, which is pivotal because what it was executive directors and some elected officials, but predominantly people who were on the front lines. And so that gave us an opportunity to compare what was happening in other cities. And down the road, when the very first AIDS March happened here, it was because we had a board member there from Boston who would travel to different cities and for $1,500 bring in an entire packet of this is how you do an AIDS March. And it was in 1986 around Phoenix College, basically, much different than the scale it is now. And so the most important thing to me about the gay community's involvement, and whether it's speaking at ASU or any opportunity I have to talk about it, is the proudest I am really as a gay man is the fact that we stepped up. In our motto in the very beginning was taking care of our own. And it was why we ultimately started out with organizations that the first organization Bob Hughey started, which was the Arizona AIDS Fund Trust. But my first introduction to the conversation was my first meeting in New York of NGTF then. And I walked into a discussion, a little bit late, but I walked into the discussion, it was raining, and I bought my first suit and carried a little briefcase, and I got into the office and everybody else was casual. The office was kind of not like this, but it was my first introduction at a time that they were just identifying in the number of cases of New York City, which would be perceived as then the epicenter.
Of the beginning of HIV.
Yeah, and then, of course, San Francisco. And so all that said, it was a quick introduction to something that was ultimately going to change my life. And my plan was law school and Congress. Politics is my passion. And was diagnosed in 1990, which was the first time I was ever tested. But what led to the start of Phoenix Body Positive was in 1987. It was 7 years into Ronald Reagan's presidency. And what tipped the scale, and it's part of history, it's not debatable, and that is that Elizabeth Taylor picked up the phone and said, "Ronnie, it is time." And it was timed with there being 2 things happening in D.C. One was the International Conference on HIV and AIDS, which may have very well been the first one. And so at that juncture, she had started American Foundation for AIDS Research. The first of their events I attended was here. It was a big production, Arabian Horse Auction, Broadway cast, Bob Hope. It was really quite something.
Big deal.
Yeah, it was a big deal. And so they also had an AMFAR dinner timed with that in D.C. So all of us that were there for National AIDS Network and people that otherwise were there for the conference attended it. And honestly, not to get too far into politics way back then, but it actually went pretty well until in Ronald Reagan's speech at the dinner, he took a turn. At first, it was a well-written speech, and then he went into a travel ban. And it was at that juncture that a decision was made.
So it was
for
a travel ban against
travel ban
people that were
coming
HIV
in.
positive.
Yeah, didn't want people coming in who were HIV positive. And that changed the complexion of how we move forward internationally, because there was not another international conference in the United States for about 25 years.
Because there was a ban.
Yeah, and because honestly, it is international. And so it would be in Paris where
course.
the Fast Track Cities initiative was launched
Yeah.
and things like that.
Well, we'll get to fast track
Yeah, oh,
cities
yeah,
and
sure,
things like
sure,
that
sure.
down the line. But thank you so much, Kirk, because I think you've really given us like the in a relatively brief amount of time, like the history of how all of this work around HIV and AIDS starts. And in what year did you start Phoenix Body Positive?
It actually started in 1990, and
Okay.
it was actually about 2 weeks after my own diagnosis. And I surrounded myself with friends, who were walking the walk. And
You said you need to do something.
Yeah, it was a peer-driven model, and that's what was different. By then, I'd already been a case manager. I thought that would be a great job to wrap around school.
Yeah.
After I stepped down as executive director of Bob Hagee's organization, the second one. And it wasn't an easy job to wrap around case management. It wasn't until you got to 50 or 70 clients. But all that said, when Body Positive started, we met with individual stakeholders, anybody that was currently an executive director of Phoenix, Shanti, Teros, all of the organizations that preceded us that were doing work in this field, Bill McDonald, because of Equality Arizona. And so ultimately what we did was we assured people, given that there wasn't much of a pie then, there was no Ryan White Care Act yet.
Right.
But it was coming. And so all that said, the decision was to not duplicate services, and what we committed to do was be a focus on advocacy specifically, and also early access to alternative therapies because that was all there was, which is why ACT UP was chaining themselves to the NIH in DC, and our local ACT UP chapter, I'm very happy to say, served on our board. We partnered with them, a wonderful soul, rest his soul, by the name of Tab Holquin. And so, but ultimately, in '87, one of the things that happened with our arrests, there were 64 of us, and they put us in different holding cells. We thought it's kind of interesting that they had to separate the men from the women, given, who we were, and all of that, most of us. And so all that said, but we were cooped up for 7.5 hours. So people that we maybe had seen at a conference or read about, we got to talk to.
So
And
you
the one that
literally are like
changed-
making plans to be the resistance while you're being held in a holding
Absolutely.
cell?
And this is the tail end of it, other than a quick thing about how we started with programs. But there was also a wonderful soul, also gone, named Michael Hirsch, and he was the founder of Body Positive in New York City. So well before my own diagnosis, I'm sitting there and I'm starting to think about what could fast track us here, what could propel us forward. And the only thing we didn't have, and even in the planning stages, was a peer-based organization. So everybody on the board, everybody that was hired initially, were all people living with HIV. And at the point that our first grant was to create an 8-week early intervention course to teach people what they needed to know. We had a vitamin and herb shop. And we also had just enough money for a resource library, which is one bookshelf. But if you can imagine now people being empowered to see.
Well, because they have resources, they have education, and then you have your peers, and so you're not
And
you're
the
not
hard
going
part,
through this
yeah, we quickly started a Women and Family Services division because it was no longer just us. But what I'm the proudest of is that we stepped up, and taking care of everybody meant everybody.
Yeah, which is important today. So I want to bring Brian into the conversation here because Kirk has laid the groundwork for your entry into this conversation. So Brian, you joined the board, became board chair, and were an early executive director of Body Positive. Tell us about that experience.
Can I give just one quick thing?
Sure you
can. Brian was, I consider, one of my best catches, landing him to come onto the board.
He is indeed a great catch.
Oh, yeah, and
Such
it was
a
just
catch.
at the point, because we launched clinical trials, we needed to broaden our board, and we needed to raise some real money, and needed somebody who had
Brian
actual
Spicker.
training in all of this as compared to visionaries who were learning trial by fire.
Yeah.
Yeah, so.
Thank you for that.
Well, how's that for
What a
passing
great
the baton?
partnership it is, and really appreciate being here, Jessyca, with Angela and Kirk. It's and you, of course.
With me. He's looking
Woman
at me
of the
calling
Year.
me Jessyca.
I love it.
I know. Brian and I are Modi and Wodi, right, from Valley Leadership's Man and Woman of the Year, the gayest Man and Woman of the Year, also the last Man and Woman of the Year. I think we broke the mold.
Yes, we did. But what's important is the mold, right?
Yeah.
Because Kirk had a vision, and I met Kirk. I came out in 1979, and then was dealing with family changes. I had 2 children, a wonderful mother of my children, and worked through that. And what I needed to do was to get involved. That was a solo thing coming out. I didn't have a lot of support at the time, didn't know where to find it. And a good friend, Scott Jacobson, said, you really ought to help us do site visits of these programs like Body Positive that got all of $15,000. And I and a couple of others said, okay. And that's where I met Kirk. And I remember looking at the resource library, and I remember the vitamin herb shop, and I was so taken with the vision and the passion of that, and was doing it through volunteerism. And then Kirk, we had conversations. We started having breakfast, and he said, you need to join the board. And I was the big step for Body Positive being peer-driven. I was the first non-infected individual, and so my impact was more about teaching people that you don't have to be infected to do something.
To make
Because
this
we're all
important in their life.
affective. We're all affected.
Yeah,
by
HIV
it.
doesn't discriminate,
Totally.
right? And so it impacts us.
Well,
whether-
it impacts people that don't have it.
Absolutely.
In terms of look what it did to the art, the design, all of the men and women who were dying of AIDS at the time.
To our
and
friends
so,
and family members.
yeah. So that was a great moment, because then Kirk, after my first board meeting, they made me board chair.
Apparently you did really
Yeah,
well in
well,
your first
I
board
don't-
It
meeting.
was quite strategic. Not an accident at all.
All we have to do is get him in the room.
It was
and
train
then we're
in
going to lock
headlights.
the door, and he will be the board chair.
But it was the partnership, and I would say what's really important in leadership is to have a board and an executive director, CEO, working in tandem. And Kirk laid that groundwork where we could begin to move from activism, which was critical, to teaching the community how to embrace this. It was one thing to say, go like this, to be pointing at each other. But it was another thing to teach the community how to embrace HIV and AIDS, the way they did heart disease, the way they did cancer, the way they did other health. This wasn't
It's a health-related
exactly.
issue. Right.
And so a lot of strategies were put in place. But, at the time, we didn't, when Kirk was running it and I was board chair, we didn't have 2 nickels to rub together. We really didn't. We were getting lockout notices from the landlord as we were building clinical trials, and we had staff. I was borrowing from our board of directors to make payroll, and they were all in. And it was this idea of the board really caring enough about the future. None of them knew if their children were going to have the horrors of what we knew at the time in the 80s of dealing with HIV and AIDS. And so they were committed to
It's
raising
the
the
best
dollars.
outcome, right?
Yeah.
Really? To finding the path forward so that
Well,
people
there
have the best
wasn't
outcome.
there wasn't a standard of care in medicine.
Right.
And through Kirk's leadership and the work of Body Positive, bringing the physicians together and building what was the largest community-based clinical trial system in the country. And our data was as great as Hopkins. So we were the largest community-based, no
How long did it
university
take for that
hospital,
ramp
no funding. This was through working with physicians and pharmaceutical companies, and the most important were those individuals who volunteered to be part of a trial, to give their blood and be part of something that would make an outcome incredible. And we've seen that outcome today.
How long did that take, like that ramp up from we're getting lockout notices to rolling out clinical trials to really bringing that data in and being able to utilize it to really like push the conversation forward.
It was like a rocket ship.
Really?
Yeah, the amount of change and adaptation that the board. So the board was 51% positive individuals. Then it changed to it. That wasn't the most important thing. So the board governance structure changed, the staffing changed, and the amount of resources necessary to support and sustain a clinical trial program, because you cannot begin these trials and not have the sustainability of it. And what it came down to was the professionalism of the staff at Phoenix Body Positive that brought those pharmaceutical companies and say, if we're going to do a trial, we're going to do it with Body Positive, because they will,
Because you had raised the
the
bar
data,
and you were
everything.
you were the standard.
Yeah, absolutely.
Can I add one thing about
Yeah.
the ramp up? So the timing of Brian coming in truly was essential. When we started out, I mean, we wrote a great NIH proposal. I missed my first flight because we were collating. I get to my hotel room, and our office manager calls.
BJ.
I'm so sorry to tell you, but there's an budget, an error on the budget page. And so I was glue sticking and everything in because it was heat bound. It was huge, 2 volumes. 17 of them had to be delivered to Bethesda, Maryland, to NIH. Got there 17 minutes because the cab driver took me the wrong end. But anyhow, he didn't know. And so, but turned it in.
But just this was frantic,
Yeah,
right?
and
Like,
the
I mean,
long
I'm
and short of
understanding
it is,
the
it was-
anxiety of all of
well,
this.
and it was such bittersweet because it was such a big part of our ramp up because we were not funded. It took nearly an act of God to figure out why and to get them to give us that level of feedback. And what they said is traditionally when they'd funded clinical trials programs that were startups in communities that hadn't rallied and the infrastructure wasn't there, in year 2 and year 3, they were in bailout mode. So we went to our board and we had people like Mike Gorman and Jim Fay hosted an Italian dinner at their home that raised $20,000. We pieced
Must
it
have been
together like
very
that.
good meatballs.
I was going to say, did you
Yeah.
have
Called the
pasta?
Positive
Yeah.
Share campaign. Everything
Positive
was
Share.
But
positive.
I love the
Yeah,
grassrootsness of this and the sense of community, and that the community just, it seems like just really comes
Yeah.
around and says, this is
Yeah.
our responsibility. We will lift one another
Well,
up. We will find the funding.
And that
we will create it.
determination allowed us to get to a point where it was true collaboration because we approached Maricopa Medical Center. We were just trying to chip away at the budget. We asked for the physician's line item. Tony Rogers was CEO then. He was awarded at Night for Life years after. But we left there with $250,000.
And that's
And we
game-changing.
got Andy Myers. And so what they did is they took a physician I approached. He was in practice in the West Valley. Just heard he might be ready to make a change, very committed to this issue. We had him 50% of his time, and it saved the day for many, many people who had as their primary place for healthcare Maricopa Medical Center, because he oversaw internship training and everything that was HIV and infectious disease. And so 50% there, 50% with us was really 60% and 60%, because he was a little firebrand. I mean, truly.
And some of the indicators of the community at that time were around philanthropy, because we didn't have a whole lot of government funding to sustain
And I
it.
I
And-
think the conversation around philanthropy, and in particular LGBTQ inclusive philanthropy, is set that's a whole nother show. But I feel like there are so many younger people that do not understand, number one, that we have come so far as a community, but also have not really been raised with the understanding that we all have to have skin in the game. The importance of investing, whether it's in what used to be Body Positive and is now Southwest Center. And I want to introduce Jessyca Leach, who is the CEO of Southwest Center, to talk about that transition, right? Like, when does Body Positive then become Southwest Center?
And when does Southwest Center become our new name that I can't
Well,
say
I
on the
know
show
in January
yet, so
we're going to have a big reveal.
we are going to have a big reveal. I think what really transitioned for us was recognizing that we needed to be able to provide the healthcare that our community needs. We can't just focus on the advocacy piece. We can't just focus on that support network. We need to be able to say, come into our space. It is safe, it is affirming, and it is a fully integrated care model. So it's not just focusing on, Brian, you need HIV treatment. Kirk, you need PrEP. Those are two separate things. But you also need mental health support. You need the support of a psych NP. And you need to know that all of your clinicians are working together to make sure that you have the best outcomes possible, because we as a community deserve the best outcomes possible. And so it shifted from that philanthropy-based model, right, with really big galas and a lot of donations, and into how do we diversify our revenue streams to make sure that through government grants, fee-for-service, 340B, and philanthropy, we can provide those services every day.
And what's 340B?
340B is a pharmaceutical program through it's had bipartisan support, I'm going to say, and it will continue to have bipartisan support, that allows us to leverage sales of pharmaceuticals and basically get the discount. So it's a little bit difficult to go into. It was enacted in 1992. It is a very literal program, but 340B was the place and the bill that it was played into. But it provides clinics like mine and others across the country the means to provide services for those who can't afford it. That's the intention out of it, is community-based healthcare agencies in rural communities who serve underserved communities have this funding option that allows us to say, it doesn't matter if you can pay, we'll take you anyway.
So everyone is welcome at Southwest Center.
Everyone is welcome at Southwest Center, 100%.
And you have a whole person approach at Southwest Center,
Yes,
right?
yes. It is a status neutral approach and a whole person approach, because it's not about your status, it's about what you need to thrive.
So, I mean, a remarkable journey since the mid 80s to here we are almost to 2025, right? So a 40-year journey of activism and of care, right, in the Metro Phoenix area for people living with HIV or AIDS or impacted, right, because of friends and family members. And we've gone from, this is, I remember in the mid 80s having friends who we lost, to this is now something that is a chronic disease and can be managed. Talk about in that 40-year journey, and I mean, obviously, outcomes have progressed in a much better way. What are some of the biggest attitude changes that you've all seen when it comes to people living with HIV and AIDS, and just like the conversations that we're having, right? Like,
I'd like to approach it from not people living with HIV, because I don't know. That different experiences, obviously, but I'd like to approach it from what we're seeing in our youth.
okay.
And what we're seeing is the lack of sex education is increasing the rates of HIV and of other STIs. We're seeing a huge increase in congenital syphilis as well, but that's a different show and a different conversation. And so there's this idea that HIV doesn't really exist any longer, right? Because it is a chronic disease. And the incidences of PrEP, which is the prophylactic to prevent HIV, we have under 8,000 people in Maricopa County that are utilizing PrEP right now. There's a lot more people having sex, y'all. Like, that's probably just
Like
Metro
way more
Phoenix.
people having sex.
Lots of people having sex. And the idea that HIV is still this quote unquote gay disease, not realizing we know it impacts everybody. And
Right.
so how do we communicate about that within communities that don't oftentimes think about these things, how they can prevent it, and what treatment looks like?
And is some of them not thinking about it because we still have a ways to go when it comes to just accepting a person's sexual orientation, right, and gender identity, right? In particular, in some of our more diverse communities,
Yes.
right? So it seems like in some communities still have a bit of a don't ask, don't tell approach to a person's sexuality and how they identify as well. But what I'm hearing from you, Jess, is that because that acceptance isn't there, we're not having probably the real world conversations we should be having to ensure that people are using preventative care like PrEP so that everyone has a healthier outcome.
100%. And they're not getting access to the testing they need. A lot of the positive reactives we're having right now to HIV tests, it's the person's first time getting tested. They're in their late 20s.
Wow.
And the reason they're getting tested is because their partner was like, hey, this is something you should probably do. So we don't know how long they've been living with HIV as well.
Wow.
Yes.
So we have a lot more work ahead of us, is what I'm hearing, and a lot of education. How do we work together to break down those barriers?
Yeah, it's interesting because I think of S curves, right? And we're, the work that Kirk did from activism and creating this vision, the building the treatments, the every Valley leadership class from class 15 to 32 did a tour at Body Positive. And understood it. So you had this S curve where education and the junior league was funding Body Positive.
Fantastic.
Think about that. Where we got to a certain point, chronic disease treatments, and we've been a little bit on the downward slope with education, communication, and acceptance again.
Right.
And so it's really about what's the next upward lift of the S curve, and it's really paradigm that needs to change. I mean, when I was involved, my goal was to get people to embrace HIV and AIDS the way they did cancer and heart. Those used to be, I remember as a kid in the neighborhood, mom's talking to a neighbor, and the neighbor's going, "Did you know that Isabel has cancer?" They went, and that's what it was like dealing with HIV and AIDS.
Right.
We needed to get it out there. We needed to talk about it and teach the community to embrace it. And I think that's where we're at. We need to educate again
It seems like
significantly,
we need to
and
really
that's what
lift up and have an
Southwest Center's
educational
doing.
campaign.
Yeah.
And I'm thinking of like I am the face of HIV, and that this impacts people of all communities, right? And regardless of your gender, right? And that unfortunately, what I'm hearing is that this is impacting younger people again, and I think that's probably new news to a lot of folks, right?
So, and one other aspect too is, I mean, I think most people who weren't around then naturally wouldn't understand how we had to fight truly for everything.
Yeah.
And one of the greatest things the organizations did was come together and created AZAPA, Arizona AIDS Policy Alliance, in part because we had many boards that were confused about how much a board could do that was public policy.
Mhm.
And so, but we also needed a concerted effort. A lobbyist was hired, Joseph Abate. And he was hired because we didn't need him to convince our people. We needed across the aisle. And that was his strength. But the greatest victory, which really changed in that moment history for us here, was in order to get the Ryan White Care Act, we had to, as a state, there was $1 million drawdown. And that was Governor Jane Hull.
Yeah.
And so it was really remarkable. And so, and in addition to that, when you're first person and you're sitting in front of a legislator and you're in survival mode, or in any other office, it's harder to say no. The most powerful lobbyists, I always believe, are moms. And so we started to see moms who had lost their kids. I mean, Ryan White, classic example. She
Yeah.
stays actively involved. But here, we had so many people who were not just because they had friends on this board stepping up, because they too lost somebody. The Parsons, to give a great shout
Yes.
out. And people wondered, and they started to put on the screen side-by-side pictures of, I believe, cousins of his. And you can tell because of the photos that they were back in time. But
And
because
so you're
of that
talking about
personal
Bob
commitment,
Parsons,
yeah,
right?
that was their personal commitment as to why they truly changed our history as an
Well, and the
organization.
Bob and Renee Parsons Foundation has been
Absolutely.
a very
Yeah.
generous partner
Absolutely.
to Southwest Center, to Body
Transformative
Transformative,
partner,
right?
Yeah.
And again, my understanding of Bob's personal story is he had two cousins that he lost and he really looked up to, right? And so those were defining moments in his life. And so he and Renee have been very committed to really, I think, educating people around HIV and AIDS for
Well,
years,
as
right?
a community, we could carry it for maybe the first
Yeah.
7 to 10 years.
Well, this needs to be
But
everyone's issue.
That's exactly
Well,
right. It was too
That's
big
it.
and it was impacting everybody.
Yeah.
So it had to be a broader community.
And I think that's the unique role of the soon-to-be new named organization, Southwest Center, is that when you look at the evolution of a disease,
Mhm.
what's happened is people, and we wanted, this was Kirk and my mantra was people were going to live long and well with HIV. That was the goal.
Long and well.
And that's not enough to what Jessyca's saying. It's not only living long and well with HIV, it's having access to health care, access to quality, access to prevention, access to health education. And when you think of the evolution of Body Positive Southwest Center and soon to have a new name, that's the evolution. And it's all about being there for anybody who is dealing with a health care issue.
100%. And it's also making sure that we're not the only place. Because I'll be honest with you, one of my biggest fears is that in the city of Phoenix, in Maricopa County, we cannot be the only place that provides affirming care for our community or for any community.
Is there a network of providers that you
Yes.
know that provide affirming care?
100%. And we work together to ensure that if the referrals are needed, whatever it looks like, we have those things in place so that you can go across Maricopa County and outside of Maricopa County to get the care you need, whether it's mental health care or physical health care.
So, Jessyca, I think one of the things that would be like really helpful from an education standpoint is to know who these affirming healthcare providers are. I would love to have a conversation with you about like ways that we can lift up who these providers are, so that people that are LGBTQ plus have access to the education of like, you know, where they should be going. And I say this, and I feel like when I say this, I almost wince, and I'm not sure if I should say this to you because I understand, you know, I think really the world that we are about to enter as we enter into 2025. And we are very aware that with this new administration, there will be very cruel rollbacks that are particularly targeting our transgender community. But I also believe it will be the L, the G, and the B as well, that our LGBTQ plus community as a whole is going to be targeted, you know, in ways that can be really damaging. So how do we make sure that you know, we're in this interesting space, right? We need to lift up the stories. We need to lift up the fact that that we need to educate people so that they are making better choices, right, and being proactive, so that they're not living with HIV and AIDS, right, so that they can remain negative and you know, it doesn't have to have this impact. And we are, you know, entering into a time with an incoming administration and a president that, you know, certainly seems to have a long memory and wants to really, really target communities, obviously our immigrant community, and quite frankly, our LGBTQ plus community too. So like, let's talk through that, right? Because I feel like we need to lift this up, but then I don't want to put healthcare providers in harm's way, right? How do we make sure that we know about good access to care and we're doing it in like a responsible way? So like, really, I think the big question I'm throwing out to all three of you is like, think about this from a medical, social, and then like, what are your policy concerns as we walk into 2025 and really prepare for what I think could likely be very demonstrative from a federal administration standpoint.
I will say from a funding standpoint, that's a whole different conversation. So about 3.2 million of our budget comes from federal grants, and they are for HIV and STI treatment and prevention, for substance abuse disorders, and then federal pass-through for the same thing. So we are deeply concerned about that funding. We're concerned about 340B. We're concerned about our gender expansive community who receives gender affirming care from us. In terms of the other medical providers, one thing I'm proud to say is those of us who do the work in the community, we're the ones yelling it from the rooftops, right?
Okay.
It's not secretive. It's not like you're ducking into a coffee shop, but really that's a clinic. So when we talk about Spectrum Medical, when we talk about Valleywise, especially their McDowell clinic, Affirming You is a great LGBTQ mental health space. Be Well. These are organizations that are already doing the work, and they're on the ground level with us. We're linking arms. We're part of Fast Track Cities together, and we're like, listen, we're here, and we're going to keep doing all of the work we're doing, and we'll find the funding. If I have to go back to raising money intensively,
It sounds like we might need to find out about this lasagna recipe because the Italian dinner, they raised 20 grand.
So if we
sounds delicious.
There was some arm twisting in there.
Probably some
Let's
wine.
bring you along as the muscle.
Sure.
And I think we can do this. I have a board that is so deeply committed to this cause. And so I think every board out there that is working with agencies like ours is buckling down for this. We know the transition is going to be rough. We know it's going to be kind of a crap 5 years, right? But they're not going to erase us. And they're not going to tell us that we don't get the care that everybody else gets.
Right.
Because that's bullshit. So
Agreed.
I think from my perspective, it's just, it's continuing to do what we do and coming together as a community instead of dividing us as a community.
It's being resilient.
It is being
really,
resilient.
It's about nonprofits and the social sector being resilient and weathering the storms. It's all about bending like a reed in the wind, because the storms come and the reed flips back up and it's there for the next day.
And really sticking together,
Yeah.
right? So that we bend together. So it seems to me like the importance of community, and you know, the LGBTQ plus community is so often referred to as family or community, like our sense of community and family and those deep family ties are going to be what helps us weather the storm ahead.
Yes, and one other public policy issue.
Yeah.
So I would say last week, Thursday or so, is the first time I saw it, and I was so worked up about it. I've been tempering strategically how much news I watch, and I don't bury my head in the sand. I know what's happening, but it's been tough. And so, but they flashed on the screen, and I've got my iPhone out, and I'm taking pictures of 3 screens, and it was specifically a House bill, and the intention of it was to put into the power of the president in general, just happens to be the wrong one in the beginning, the power to take nonprofit organizations, to evaluate those organizations and have the ability to, in a cease and desist kind of way, even to the point of taking organizations and determining as president that these are considered terrorist organizations. What's odd about that is the fact that the long list of organizations included environmental, health services organizations, but it was probably 8 to 10 different categories of organizations. The first vote failed. And so I thought, well, that's a good sign so far. I mean, it's still 2024. However, I'm watching the news again this week, and they literally have brought it back. They've made a couple tweaks to it, and they've brought it back. Well, it can't pass. So there's a national organization that's helping to coordinate an effort. But like in the old days, I mean, they're asking people to call their legislators, their congressmen specifically, to make sure that they know how important that is and how un-American all of it is. And to
Well,
make sure,
dismantling the social sector
absolutely.
I mean, it is the nonprofit sector that is the ointment that deals with the gaps and the challenges that our imperfect society faces. And to dismantle that would be a horrid mistake. It's what makes the United States and America great, is one of the things, the power of the nonprofit sector. You don't see that in other countries, what we have here. And to place that in cease and desist power into an individual would be dangerous. That's why communities create nonprofits, not individual.
I mean, it will be hard to stop. I mean, there's no doubt about that, because there is a community that we're not going back. I mean, as my personal champion in this last round, Kamala Harris, we're not going back, and we've got to follow that. We can't quit now.
Well, and I think we were talking about this before lights, camera, action here, but it's important to remember that this incoming administration does not have a mandate. That in actuality, more people voted against the person that's going to be the 47th president than voted for him, right? And so obviously we are pretty evenly divided here in the United States, but to say that it's important to ensure that every American has healthcare opportunities, I think is something that we should all be able to rally around.
Agreed.
I think once we're back in charge, I mean, one of the things I personally hope, let me just say, Barack Obama, after his presidency, he was asked a question, and the question was, if there were 3 things that you would like to have done while you were president, what would they have been? The one that said the most to me personally was, he said he'd like to have been able to raise the income amount for people who are on disability. So rather than being capped at, when I started, it was $750, then it went up to $850, and $1,000 max. Which is hard to do from a quality of life standpoint and out-of-pocket medical. And the other thing that is always stuck in my craw, I just have to say it, is it was also a Republican administration, but think about how this country politically and government funding and all, with the resistance to it, shot themselves in the foot when they nearly eliminated any sort of real tax break for people who are giving to nonprofits, who are picking up the pieces in large part that the federal government would rather not do at all. And so people still give, fortunately, but they're giving more from their heart than because it's a potentially bigger tax bracket for them, a tax break on a bigger bracket. I just don't get that. So that's one thing that perhaps down the road we'll be able to fix.
I can't speak to the political side
Yeah.
because I do run a C3, and lobbying and taking politics gets a little bit complicated, and I obviously have my personal feelings about it. But I will say, from my perspective, you've made excellent points. We provide the services the government doesn't want to provide, but people need. We don't have the social networks that other countries have to take care of people. So nonprofits like mine, nonprofits that take care of people experiencing homelessness, they are all stepping in. If you dismantle structures like ours and you dismantle the government structures that allow public funding to flow through to agencies that might provide that help from the government side, what is the everyday person going to do?
Well, there's no services being
There's
provided.
nothing.
Yeah, I mean, it's absolute chaos.
And that is my
So we have
biggest
our work
concern.
ahead.
Yeah, we've got to conquer chaos.
Okay, so Jessyca says we have to conquer chaos. We need to bend like reeds in the wind. We have to be the resistance, and also like really, really come together. And I think and work together. Right?
Lean in.
Lean in
Yeah.
and understand the environment we're in. With all that being said, I want to end this episode with what's your hope for where we're at in 5 years? I understand that we are walking into some more difficult challenges.
So
Where do you hope we come out of this?
I'm going to be really selfish right
Yeah.
now because this is such a deeply personal issue for all of us. I want my clinics like mine, to be safe and to be able to maintain for the next 5 years and provide services. And selfishly, I want my agender lesbian child to be in a world that will protect them and will acknowledge their sexual identity, their gender identity, and they can continue going to school without fear.
Kirk?
Well, first up, a quick shout out. One community. So we learned at that point that we had to pivot and go beyond our community to support who we are and what we do.
Mhm.
And so the work that One Community has done to bring that whole army of allies and keep us together and not siloed has been pivotal. And we're going to need everybody.
Yeah,
I
it's
mean,
gonna
we're
take us all.
fierce, but we cannot do this alone. And we've got to be able to be on somehow or another to the extent it's possible. There are some moderate R's and all of that, but the politics
The majority of Americans, and I believe the majority of elected
Absolutely.
officials are somewhere in the middle,
I
right?
believe it.
And
I
so
believe
we
it.
have to go in, and I mean, I think for us, it's we will have a conversation with everyone, and we will have a conversation with anyone, right? And we're known for being very determined, and we'll be more determined than ever. But I'm a big believer you never make assumptions, and so I think for us, it's the key to leaning in, having a cup of coffee with everyone and anyone, and really asking, right? Like, can we sit down? Can we talk about this? And where can we find the common ground?
Well, and to that end, very quickly, about One Community, that you keep doing what you do. And because 5 years, that's a pivotal juncture, and it's a pivotal juncture. And I will just say, I'm political all through and through. Politics is my thing, as I said. But we have to. I mean, there has to be enough of a blue wave that in 2026, that we start taking back some of the House and the Senate, and we have to take the White House in 2028. I mean, for me, that's become my new reason to keep fighting. I mean, to live, and for other reasons. But it is indeed going to take a coordinated effort, and that's you, that's us. It's the world. I mean, we do have an impact on the entire world. That part right now breaks my heart, but we've got to get back to the America that we can be entirely proud of.
It's the betterment of all, right? And what we always talk about from a One Community standpoint is when you protect LGBTQ plus people, we're creating a more sustainable Arizona for everyone, right? Like equal treatment and fairness lifts us all up. It's not just the groups or communities that don't have equal treatment in policy, right? Or equal access to health care. That when we create equal opportunity, we all have the opportunity to thrive.
Agreed.
Brian, take us home.
Well, being a grandfather of a 9-year-old and a 13-year-old, 5 years from now they'll be teenagers. Well, one is a teenager, I guess.
One will be
13
voting.
Just became 13. One will be voting. That they live in a safe and caring environment, an environment that accepts all people where they are at, when they are at that place, and that they're safe, that they've been provided the education. And so I'm saying my grandchildren, but that's a metaphor for all children, all teenagers that are moving forward in life, that they have access to great education and a great life. And that's my hope and vision for the future. That's what keeps me moving.
So it's about all of us, and it's about creating a great future for the little ones that are coming after us. Wonderful. Thank you all so much for this.
Thank you.
Thanks for the
Just
opportunity.
Deeply grateful.
Same.